Welcome to our video presentation investigating physiotherapeutic interventions for the treatment of low back pain, a widespread and impactful condition affecting millions globally. Recognized for its substantial toll on well-being, low back pain is particularly prevalent among the working population, causing suffering and disability, especially in high-income countries. Associated with disability, stress, sickness absence, and reduced labor productivity, its prevalence is expected to rise with an aging population, particularly among those over 60. Non-specific low back pain cases, accounting for 90%, have an unknown underlying cause. While psychosocial factors play a pivotal role, it's crucial not to overlook the biomedical elements. In the realm of physical therapy, we explore physiotherapeutic interventions, including fascia tissue manipulations. These interventions target the fasciae with techniques like soft tissue mobilizations, myofascial release techniques, joint mobilizations, and elastic tape application. While some claims are unproven, fascia tissue manipulations have demonstrated small to moderate positive effects on pain reduction and improved function. To optimize these interventions, identifying the precise location and direction for myofascial release, elastic tape application, and joint mobilization is crucial. Hence, a test was developed to lay the groundwork for pioneering the 4XT method. The foundational principles of the 4XT method, a protocol renowned for selecting the most fitting interventions, determining the optimal location, direction, and intensity for addressing musculoskeletal conditions.
Test. The 4XT method always begins with a test where the patient performs maximal trunk flexion and maximal trunk extension movements to determine pain and range of motion values. The directional preference is identified as the direction causing the least pain, and the reference direction is identified as the direction causing the most pain. During the reference test, skin displacement is performed based on the 4XT back protocol to determine the optimal trigger and tape direction. The direction of skin displacement resulting in the most notable reduction in pain score and increase in trunk range of motion is chosen. If the reference test without skin displacement yields the best results, no intervention is indicated. Trigger. To apply the triggers, a cluster of fascia releases is used in a standing position with slight flexion, followed by the open fist and adduction technique to release the fasciae and muscles. Tape. After the triggers, elastic tape is applied at L3 in the positive skin displacement direction and the reference test is repeated to assess the intervention effect. This process is repeated at subsequent locations until an acceptable pain level is achieved for rehabilitation training.
The purpose of this study was to evaluate the effectiveness of the 4XT method in NSCLBP individuals by comparing it with exercise-only therapy, using three outcome measures: the change in trunk range of motion, mobility-dependent pain, and quality of life. The effects were measured during a 6-week treatment period. Furthermore, it was analyzed how long these effects lasted using a 6-week therapy-off period. Total 50 individuals with nonspecific chronic low back pain were subjected to random assignment into either the 4XT group or the exercise-only therapy group. All assessments were carried out at distinct time points, prior to group allocation, baseline, during the 3rd week of the treatment period, after the 6-week therapy-on period, and subsequent to a 6-week therapy-off period. The treatment regimen involved 2 sessions per week, adhering to the allocated program. The results unveiled notable interaction effects across all measured outcomes. Within the 4XT group, substantial and enduring improvements were observed over time in mobility-dependent pain, accompanied by an associated increase in trunk mobility and overall quality of life. These gains showed no significant relapse post-therapy, except for extension mobility. On the other hand, the exercise group exhibited noteworthy within-time changes specifically in the quality of life, as assessed by the visual analog scale, whereas no significant changes were recorded for EQ5D3L, trunk mobility, and mobility-dependent pain. Results of this study demonstrate that the 4XT method stands out as a promising and impactful treatment option for individuals dealing with nonspecific chronic low back pain. The substantial reductions in pain, increase in trunk mobility, and the notable improvement in overall quality of life, when contrasted with exercise-only therapy, emphasize its potential clinical significance. Specifically, analyzing the application location and direction of fascia tissue manipulations and the direction-specific training guided by the dynamic arthro-myofascial translation test within the 4XT back protocol demonstrated lasting effectiveness, evident even after the 6-week therapy-off period. Continued investigation into the application of the 4XT method is warranted. For a comprehensive understanding and more detailed insights, we encourage interested individuals to delve into the published work. Your continued engagement and feedback are invaluable. Thank you for joining us on this exploration of the 4XT method's impact on chronic low back pain. Until next time, take care and stay well.